We are seeing massive tear of the rotator cuff from anterior to posterior C-shaped structure. There is about 2 to 3 centimeters of retraction. This is a traumatic tear in 69-year-old male. We have now created the anterior lateral portal viewing from posterolateral area. We are now starting to put the medial row anchor. This is double loaded anchor. We can put 3 loaded anchor. Here we have decided to put double loaded anchor front and double loaded behind, meaning 4 bites in the front, 4 bites behind, 8 bites. First, we are taking tiger wire. There is a tiger wire and the blue wire. We are taking a bite in the anterior most part of the cuff. The thread which comes out, we will be parking in the anterior portal. So anterior half of the rotator cuff will be taking 4 bites, posterior half will be taking 4 bites. Anterior 4 bites of the two double loaded anchor, all the 4 we will be parking in the front and posterior 4 will be parking back, and we will be then going on with the sliding knot. You can see that we have to use 2 tiger wire and then 2 blue colored. You can see there is a delamination, that is a 2 layers of the rotator cuff. We are taking bite both together. Sometimes we have to use medial row with the inner layer. We can do that. In this case, we are using both the layers in both the medial and lateral. We have completed the anterior 4 threads. Now we will be going posterior anchor, which is also medial row anchor, two loaded. So we are taking tiger. So to avoid confusion, we have to do 2 tiger wire, 2 blue color, again 2 tiger wire, 2 blue color, so that we will know that 2 tiger and blue colored are from the front and tiger and blue color from the back anchor. We have to continue the same step, taking bites, and when the thread comes out from the cuff, we have to park it in the one of the portals. We use usually the portal used to make the anchor insertion. After we have completed, complete the taking bites, we have to do then doing the sliding knots. So the knot will be exactly at the position of the anchor. So the area of the cuff, which is between the knot and the outer end, is the rectangular strip. That is the one which sits directly in contact with the raw surface of the humerus outside the articular part and where the healing of the rotator cuff takes place. So we can use 2 lateral row anchor or 1 lateral row anchor. Here we are using 1 lateral row anchor. All the 8 threads, that is 4 pairs of the threads of the 2 anchors double loaded. All the 4 we are taking out and taking through one cannula, and we will be then using the swivel lock anchor, that is the lateral row anchor. You can see that the rotator cuff is completely seated in the raw surface, that is extra articular surface of the humerus over the greater tuberosity area where it was before, and this is the area which will have blood circulation from the bone and healing will take place. You can see that as we see the whole of that part is covered with the cuff, and rotator cuff is completely nicely repaired. Now we will be cutting the threads of the lateral row anchor. Alternatively, we can put 2 lateral row anchors and 3 medial row anchors in such massive tears. However, we have chosen to do 2 medially and 1 laterally in this case, as this is a very thin built patient and low demand and osteoporotic bone. Thank you for watching this video. If you have liked it, please like it and don't forget to subscribe to my channel. Thank you.